One of the things we always tell people at the Residency Showcase is just more in depth about our program because it's very different than some of the other PGY ones. So the first thing is just the training location. So being in family medicine, they have the opportunity to do almost all their training in the outpatient setting, and so that's different than most PGY ones which are in the hospital. And then of course we love family medicine because it's cradle to grave, you know, it's babies all the way to people who are in their 90s, so you really get to take care of the full spectrum of ages and also conditions. So the other thing that makes our program unique from a lot of the other programs is the longitudinal nature. So that's not only our PGY1 but also our PGY2s. And ours, instead of doing 1 month blocks at a time, we actually incorporate several different rotations into a week, and they continue those rotations for at least half a year, if not an entire year. You know, we think it's great because you get to form relationships with the patients, you get to form relationships with the providers and other interprofessional team that you're working with, and then also your preceptors. So that relationship building is really important. The other nice thing about that is they can see sort of the consequences or the outcomes of their therapeutic decisions. So let's say they decide to change someone's diabetes medicines. They get to follow up with that patient in a month, 2 months later to see the outcome of those changes. That's sort of the best way to learn, when you're able to make a decision, see the outcome, and then regroup. Oh yeah, that went really well, or oh, that was a horrible idea. You know, what do I do next time? So what I tell people is I want you to feel slightly uncomfortable when you're in clinic, but supported. Because I think as adult learners, we really grow when we feel uncomfortable, when we struggle a little bit, but knowing that they always have a safety net and we're not going to let them make poor choices and we're going to be there to support them. So our residents, even our students, have a high level of autonomy even from the beginning.